Sawadee. Good afternoon from Bangkok, Thailand. And this is Stay Healthy, Dr. Talk, Facebook Live from Bumrungrad International Hospital. I'm your host, Dr. Brian Kunakam, and I'm a naturopathic doctor. During this session, please feel free to ask us questions or comment as needed. We'll try to get back to your questions as soon as possible. Today, joining us, he is one of the leading urological surgeons in Thailand with skills involving robotic surgery and minimally invasive urological procedure. He'll be talking about one of the cutting-edge technology that we have today in prostatic treatments, water vapor therapy for enlarged prostate. Please give us a warm welcome to Dr. Teerapon Amornvesukit. Sawadee.
Good afternoon, everyone.
How are you today?
Fine.
Great. Well, today we'll be talking about the prostate, and I have a few, I just know that prostate is located between the bladder and the penis, right? And then the urine flow would go through the prostate. Did I get that right?
Yeah.
Okay. Is there anything you want to add to that, to my anatomy knowledge?
Yeah. Okay. The prostate is an organ that located just underneath the bladder, surrounding the proximal part of the urethra. When you're very young, the prostate size is around walnut size. And when you're getting older and older, it's become bigger and bigger. Sometimes it's big like a tangerine. Okay? When it's growing bigger and bigger, it may cause the urinary problem. What is the function? Do you know?
So I know that it creates nourishment to the sperm. That the sperm can survive and fertilize the egg. Yeah. So it kind of is our fertilizer, I would say.
Yes. It preserves humankind. It preserves sperm. Okay. It's the prostate secrete the fluid that protect the sperm can live longer than in the vagina.
Yeah. Wow. So in terms of the prostate size, what is the cause of it getting bigger as we get older?
Okay, when every man, when we are getting older, the prostate size will be bigger and bigger. Okay, especially in some country, in the family history of enlarged prostate, they will getting bigger. Okay, and when it gets bigger, it will narrow or compress the urethra. That can make a urinary problem.
So the urethra is a structure in which the urine would flow through. So as the prostate gets bigger, it just closes off the flow. And I've seen a lot of my patients, they said, okay, I wake up in the middle of the night and I pee quite a lot. That's because this could be one of the reasons, right?
Yeah.
And how do we treat it usually?
Okay. The first is that you have to know the prostate symptom, or we can call the lower urinary tract symptom, LUTS. Okay, LUTS is composed of 7 symptoms of urination. Okay, the first is more frequent urination. The second symptom is a nocturia. The patient has to wake up at night more than one time at night. The third, they feel urgency. You rush to toilet when they want to go to toilet, they will rush. Sometimes it's leakage. Okay. Then the other symptom is slow urine flow. The urine jet is very slow and getting wet on the food. Sometimes they need to push when you urinate. Okay. And if they don't push, then the urine stops. That may take second round, third round to urinate. And after they finish urination, they feel some residual. Some amount of urine remains in the bladder. They feel uncomfortable and need to go to toilet again. Now this is the symptom of the prostate enlargement.
That does not sound fun at all. So that is the symptom of LUTS, L-U-T-S, yes. Right? Frequency, urgency, slow flow, residual, and nocturia. Nocturia meaning that you wake up in the middle of the night to go to pee. And is this only a manly problem, or does it, I know that females don't have prostates, but can it affect females too because of the manly problems?
Okay, the urinary symptom not only affect on the male, it can affect in the female in different problem, the different disease. Okay, but the most common for the men who age more than 50 years old, is almost unavoidable to have the prostate problem. The incidence to have a prostate enlargement growing up with the age. For example, when the patient have 50 years old, the age is around 50 years old, around 50% have the symptom. When the age up to 70 years old, this problem up to 70% of the patient. So it's almost unavoidable.
Wow, 50% at 50 years old and 70% at 70 years old?
90%, 90 years old.
Oh, wow.
Easy to remember.
Very easy to remember, and I think I have a few more years left before I reach the 50%.
Yeah.
Okay, it does not sound fun at all. And if you guys are watching, if you're a female, you're still not, and you have husbands or a partner, you would know that this is a problem for you guys too, because it's a problem where you have to wake up in the middle of the night all the time. Now that we know what the problem is, usually what is the solution to this? How do we get treated? How do we, well, first of all, how do we get diagnosed?
Yep. Okay, when the patient see the urologist, the urologist will check the prostate. Okay, how do we check the physical examination? We use a digital rectal examination to feel the posterior or back part of the prostate. Okay, to estimate the size of prostate and to feel is there any lumps or abnormal nodule at the prostate. The next step, other than the history taking, the next step is to test some tests. The basic test of the prostate is around 3 tests. The first is urine test. For the urine test, we check for infection and uroflowmetry. Uroflowmetry is to check the speed and the graph of urination. Second test is a blood test to check PSA to differentiate prostate enlargement, benign, and cancer. And the last test is to check ultrasonography to measure the prostate size and to check the bladder, kidney function, the bladder and kidney anatomy. Yeah, this is a basic test of the prostate assessment. After we get the whole information, we will check. We will classify the patient in 3 groups. The first group is mild symptom, okay, and no anatomical change. For this patient, we use only behavioral treatment to adjust water intake, to avoid caffeine, avoid alcohol, and time urination to make his life better, improve quality of life for the patient with mild symptom.
Wow. Okay.
And for the patient with moderate or severe symptom, sometimes we start with medication. Yeah.
Okay. Wow. So recapping that, you actually have to go through a certain process of being diagnosed first. And from the diagnosis, we actually can tell whether it's mild or moderate, right? And don't try this at home. Just now, Dr. Teerapon just talked about the digital rectal exam. That's where doctors would put their finger into the anal canal, and then they'll try to feel the prostate, right? Then after that, if there's an enlargement or it feels enlarged or something hard in there, then we would go through different processes, which we have listed out 4 earlier. Then we'll decide whether you're in a mild or moderate condition. Based on this, it seems like if it's mild, it can be a behavioral thing.
Yeah.
So what time would you say that we shouldn't be drinking water if we're having this waking up to go to the bathroom all the time?
Yeah. Okay. Normally, we advise the patient to drink water, medium amount of water, not too much, not too low. And especially when the patient have many time to wake up at night, okay, they should avoid water 2 hours before bedtime. Yeah.
2 hours before bedtime. So that's the magic number, okay? For those of you who have been walking up to go to the bathroom every night, make sure 2 hours before try to not have water.
Not only avoid the 2 hours before bedtime, it's better if you exercise in the evening to get rid of the excess fluid.
Exercise. That's the one thing that a lot of people are missing. So definitely, if you're having a lot of fluids, exercise and do not drink water 2 hours before. I'll keep that in mind when the time comes. Or should I start practicing now too?
Yeah.
Okay, definitely.
Not now, you're so young.
Oh, thank you. So if the symptoms get worse, let's just say we're beyond mild and moderate,
Yeah.
what are the treatments different at that point?
So in past after when the patient who taking medication, okay, and they get well with the medication, the patient's symptom is very well, okay. They usually take the medication for the whole life. Whole life is a big trouble for many patients, okay. And if the medication have some side effect, okay, for example, they cause low blood pressure, dizziness, okay, lethargy, and nasal congestion, and retrograde ejaculation. This is a common side effect of the prostate medication, including the sexual dysfunction. So many patients have this problem and have to take this medication whole life. Okay, for this group, okay, we convert to surgery, okay, but the surgery have a big problem for many patients. They have to pay the price. What is the price? Is a sexual life change. Okay, now we have the treatment in the middle between medication and surgery. Okay.
Okay. Wow. So that's a lot to take in. From the medication, you have those side effects, huh? And if we go beyond that, taking the medication, more medications does not really solve the problem. That's where we end up with surgery. And with surgery, we still have those side effects of sexual dysfunction. I heard you mention about retrograde ejaculation. Could you explain a little bit more what that is for people who do not know what this is?
Yep. Okay, about the retrograde ejaculation, this can cause by prostate medication we call alpha blocker. Okay, this medication block the internal sphincter that make it relax. When the patient ejaculate, it will retrograde or ejaculate back into the bladder. We call retrograde ejaculation. This sometimes it could be found around 10 to 20% of the alpha 1 blocker. Okay, and retrograde ejaculation can come after the surgery. It's very common and sometimes it's unavoidable. It could be found at least 70 or 80% after the surgery. So sometimes surgery make the patient urinate very well, but something lost.
Wow. Okay. So you did mention that there is something in between medication and surgery.
Yeah.
Is that what we're talking about today, the water vapor therapy? Awesome. So can you tell us a little bit, how is this in between medication and surgery?
Okay, this is called minimally invasive procedures. Okay, it's not surgery. So today we are talking about water vapor treatment for enlarged prostate. Water vapor. Okay, so this procedure is it was born around 5 to 6 years. So US FDA approved in 2015. So this is a quite new technology for 6 years. This technique is that I mentioned is not a surgery. It's just injection at the prostate. Injection, what injection? Is injection of the water vapor, okay, into the prostate. That blocking, only the blocking part of the prostate, okay, not the whole prostate.
Wait, going back a little bit, when you say water vapor, is it really like you evaporate the water, you're using heat to evaporate the water and inject it into the area? Is that what you're talking about?
It's a very good question. So it's different from the water vapor that you see when you boil the water.
Okay.
Different. It's a water vapor that created from the generator, the radio frequency generator into the water, okay, into the coil, and make it vapor in a small particle of water vapor.
Okay.
Yep.
Wow. Well, and with that, it can help reduce the size of the prostate?
Okay. This water vapor temperature around 103 degrees Celsius. Okay. When it is injected into the prostate tissue, is dispersed, spreading, it like a ball, okay, homogeneous ball, and the temperature is around 103 degrees Celsius, and then the water vapor is condensed and release the energy.
Wow.
That make the prostate cell temperature more than 70 degrees Celsius.
Okay.
If the cell temperature more than 70 degrees Celsius, the cell dead.
Okay, so that's how the prostate gland that is enlarged gets killed, because it undergoes programmed cell death on its
Cell
own.
death, yes, and then it will be resolved naturally.
Okay, so you did mention that there's US FDA approval in 2015. How about in Thailand? Is there Thai FDA approved as well?
In Thailand, Thai FDA approved this year, in the early of this year already.
Oh, wow, okay. That's awesome. So in terms of FDA approval, it just means that you're not the first one to get this treatment. There's been studies made and it's been approved so that it's safe and effective.
Yeah, totally in the world, sorry. In the world, this technique, water vapor, or the trademark is a Rezum. In the world, until now, I think around 100,000 patients have been treated with this technique.
Rezum technology. So this is called Rezum therapy, which is another name for water vapor therapy. Now, you got me excited about this a little bit, but I heard that we have a clip regarding how this is done. Could we roll that clip for a little bit, and then you can help explain what we're doing and what we're seeing here? What am I seeing here right now?
Yeah, the Rezum instrument have incorporated with endoscopy. The instrument passed into the natural channel urethra and to the prostate, that the blocking part of prostate. And then we deploy the needle and inject the steam, which the steam spread between cells. The size of spreading is around 2 centimeters for each injection. Each injection takes only 9 seconds. And then we move to other part, 9 seconds, 9 seconds. So for the small to medium prostate size, it takes around 4 to 6 injections. Take around 5 to 10 minutes for the procedure, very short. And the patient can go home outpatient without admission.
All this takes 10 minutes, 4 to 6 injections that you were talking about earlier.
Yeah, but for the bigger prostate, some patient takes 8 or 10 injections. Yeah.
Okay, so it is a walnut size from the picture that we saw just now. That is the prostate for all of you who have been wondering what we're looking at. Now, I did see there's an endoscopy that goes in.
Yeah.
Is that painful at all? Not that I want to try. Is it painful going in?
During the procedure, the nurse, the anesthetist will inject IV sedation. So during the procedure, 5 or 10 minutes, the patient sleeps and doesn't feel anything.
Okay, so you're asleep the whole time, you don't feel anything, and then once you wake up, your prostate is back to a normal size. Is that how it works? Wow. 10 minutes only, and how long does usually a surgery take in general?
In general, because of the preparation time, the cleaning time, so totally in the operation room, it takes around 15 to 20 minutes. But the procedure itself is around 5 to 10 minutes.
Wow.
Yeah.
5 to 10 minutes compared to the preparation time and everything, anticipation while you're waiting for you to be sedated. This is something that's really, really interesting. Now, I'm wondering, once the patient what's the effectiveness of this in terms of the treatment itself?
Yeah. Because we're talking about the effectiveness, I have the very important information. Every patient, when we inject the steam, the prostate will get swollen. Okay, So every patient, we have to put the catheter in, okay, and then we make appointment to remove later.
So for those who are wondering what the catheter for, it's because once the swelling happens, I believe it closes up the urine flow.
Yep.
So we need to have a tube that allows you to urinate during this
tube.
process. And the inflammation process seems to take around 7 days to go away maximum, would you
Yep.
say?
So how long is the most common question of the patient? How long I have to take the catheter in? Okay, it depends the factor. It depends. For example, it depends on the prostate size. It depends on the how many injection that I use. Okay. For example, if the patient have 30 to 40 grams, with we use around four injection
30 to 40 grams of
prostate gland.
How big is the prostate usually in size, usually, the mass?
So 40 grams of prostate, the size is around ping pong ball.
Okay.
Okay.
Wow.
So every case we measure by ultrasound before the procedure. Okay. For about the 4 injection with 30 or 40 grams, we put the catheter in around 4 to 5 days.
Okay.
Yeah.
So
For the patient with huge prostate gland, for example, 70 or 80 grams, okay, normally we inject 8 more than 8 injection or 10 injection. So the patient need longer interval of catheter.
Okay. So if they need a catheter, why would they choose this over surgery?
Yeah. Okay, because of this technique have something different from the surgery. Okay, that I told you. The surgery we have to make a big channel, big urine channel immediately to urinate. But this technique takes time. After we inject, every case the prostate gets swollen. Okay, and we have to wait until it shrinks. Its effect of the shrinkage and easily and better urination is takes after 1 month.
Okay, so results will show up after 1 month. Compared to surgery, you will see it right away. But I guess Rezum allows us to have lesser side effects.
Yeah. So the benefit of this minimally invasive procedure is the first is the patient have very few blood loss, just couple drops of blood loss. Okay. Second, they do not need to stay in the hospital. We treat in outpatient. After the procedure, they can go home. Okay. And the next benefit is surgery that I explained that almost every cases, at least 70 to 80% after surgery, they have sexual dysfunction. What is a sexual dysfunction? The first is dry ejaculation. The patient never have something the same again. They ejaculate without sperm. So the second is around 10% of the patient have surgery. After TURP, they have erectile dysfunction. But this technique, Rezum or water vapor, almost 0% that affect the ejaculation problem or erectile dysfunction.
Wow, so beyond just not staying in the hospital, because usually with TURP, you might have to stay a night or two. But with this technique, it's just for 10 minutes only. And after that, compared to surgery can sometimes have that erectile dysfunction side effect, while Rezum will not give you that. That's like, for men, that's a big thing. Because I know that erectile dysfunction is so big for men that they are concerned about any type of surgery involving that area.
Yeah.
And this solves that problem completely.
Many patients, do you believe me? Many patients told me that if I do surgery, I will be a cripple.
Oh, I can.
You make me cripple.
I can feel them too, because being a man, I guess that's one of the important things in terms of sexual function. Now, after the procedure, how long does this result last?
Okay, so because of this technique, have around 5 to 6 years
Mhm.
uh, from past. So there are many studies that follow up 5 years after the procedures.
Mhm.
Okay, the result very important. The result of Rezum, okay, only 4 to 5%
Mm.
need retreatment, resurgery
Mhm. So the
at
reason
five
for
years.
at
At 5
5
years.
years, the reason for this is because the prostate gets bigger again.
Okay, the reason why some patient the prostate is bigger. Okay, and the 4 to 5% that the patient retreat.
Mhm.
Okay, they can retreat with Rezum again, or they can switch to surgery.
Wow. Okay. Definitely getting Rezum if it were me. 'Cause, I don't want that erectile dysfunction. So you can get retreated again, even though you've already been treated. And it seems like because this technology happened in 2015, 5 to 6 years only. So it's hard to say at 10 years, 15 years. But I guess seeing what we see right now, 4 to 5% is a small number.
Yep.
And I can guess that 10 to 15 years ahead, it will remain a small number, would you think?
Yeah, and comparing to the surgery, the patient after surgery, sometimes they have to redo surgery,
Mm-hmm.
10 to 15% in 10 years.
Oh,
So that's not 0% for surgery.
So surgery, you still need that. And if you do escape that 10% of erectile dysfunction, getting the surgery again puts you back into that 10%.
Yeah.
Okay, more of a reason why I would pick this. Not that I want big prostate or anything, but I'm just saying if it were me. So in terms of this, who's a candidate for Rezum technology or
Okay.
therapy?
The patient that candidate for the Rezum therapy, the first is the prostate gland size between 30 and 80 grams. Okay. The second, the patient who taking the prostate medication and does not want to take long for the whole life. They want to change because the symptom is not getting better.
Mm.
Or they have a side effect that I told, the side effect of the medication.
Mm-hmm.
Dizziness, postural hypotension,
Uh-huh.
retrograde ejaculation, nose congestion,
Mm-hmm.
lethargy. So these are the side effects of the prostate medication. Sexual dysfunction is another side effect of prostate shrinking medication.
Okay.
Okay. So the next thing is the patient who taking the prostate medication and not getting better, have side effect, or seek another option other than surgery. And the last indication is the patient who doesn't fit for surgery. Okay, do not need to have a big surgery. They doesn't fit. So this technique is outpatient treatment with minimal blood loss.
Mm-hmm. So I know that a lot of people at home might be wondering if this is people who have prostate cancer would be a candidate for this.
Prostate cancer is not indicated for water vapor, so only benign prostate enlargement.
And the reason for that is because we have a chance of spreading the cancer cells when we disturb it with heat, was it?
Yep. So every patient before the treatment, we have to differentiate who is the cancer, who is potential or have cancer, who is benign. So the Rezum or water vapor used for only benign prostate enlargement.
Wow. All right. So now in terms of the Rezum therapy, it seems like before this technology, there's been more heat technology we've used with the prostate before.
Yeah.
So this is not the first one of its kind.
Yeah, very good question.
How's this different from the heat source that we used before?
The prostate treatment using heat to destroy the prostate cell, we have this technique around 20 to 30 years ago. But for example, is a microwave thermotherapy. Yeah, this kind of energy do not have a not uniform heat spreading to the prostate cell. The prostate cell that close to the energy source
Mhm.
is very high. It's got very high temperature and must be reduced that is far away. So the prostate cell that receive the energy is not uniform. This is the first time that the heat spread is uniform spreading. We call convective heat transfer. So the prostate cell that far away can receive the same amount of energy, not like the previous treatment is not uniform heat transfer. So it's a predictable prostate destruction.
Okay.
Yeah.
So I did see that you have the machine here with you today, which looks like a gun right there. Would you be able to tell us how is it uniform compared to the heat is not uniform in terms of that?
Okay. So today I brought this is an applicator.
Uh-huh.
An applicator.
So that's exactly what it looks like that he uses in these procedures.
Yeah. Or this is an applicator that connects with the generator.
Mhm.
The generator created the radio frequency of vapor 103 degrees Celsius and pressure to the tip of the instrument. This instrument have incorporated with the endoscopy at the tip. So when we move to the prostate enlargement that block the prostate, we deploy the needle. This is a 18 gauge needle. We deploy the needle with around 12 holes.
Mm.
The steam was injected into the prostate tissue and spreading around 2 centimeters in diameter.
Wow.
Per
Uh-huh.
each injection.
Okay.
Okay. And then we move the needle back and re-injection to the new area. So each injection takes around 9 seconds. 4 injection is around less than 1 minute.
Wow.
So the procedure is very fast. Yeah.
From the video that we see, it looks like it's a little bit bigger, but this is actually really small compared to a pen. If you actually zoom in, it's really small. And if you look at, for example, this is a prostate right there, right? And we're trying to target here. You were explaining earlier that our classical method of using heat tends to be a problem because it doesn't disperse the heat uniformly throughout the whole prostate. But this one, you can actually disperse the heat uniformly to cover more areas. Is that right?
Okay. So the prostate has many zones, but the zone that block the prostate is transitional zone and central zone. So this technique destroy only the blocking zone, transitional zone, or central zone. Okay, do not affect the whole prostate.
Okay. So to recap that, the prostate also has their own landmarks. There's many landmarks for it, and the landmark in which we're most interested in treating is called the transitional zone. Because if you treat other parts of the prostate, we might destroy the tissue that is not needed. And it seems like this technology aims at a certain spot of the prostate, so it doesn't affect any other structures.
Correct.
Is that the reason why it helps in terms of sexual dysfunction? It doesn't affect sexual dysfunction?
Of course, of course.
Okay. Versus surgery, there is a tiny chance that you might get the nerve.
It affect only the blocking part of prostate.
Huh. So on top of not staying at the hospital for too long, you get the same result as surgery, minus the side effect of sexual dysfunction, and so little blood loss. This is what Rezum does for us. For those of you who have questions regarding to this technology, let me look through what other questions we have from our viewers today. Is there anything you want to add regarding the technology?
Okay, I have a take-home message to tell everybody. Okay, 5 and 4. 5, who is indicated to do Rezum. The first is the patient who take prostate medication and does not want to take the whole life. The second, who have the side effect from the medication. The third, who take medication but the symptom doesn't getting better. The fourth one is who indicates surgery and does not want to have some side effect from surgery. And the last one, the patient who does not fit for surgery. So this group indicate for Rezum. And another 4. What is the 4? Is the result of Rezum. The result after Rezum, the first is there are many studies that 5 years after Rezum, they still have a significant improvement of the urination. We call in symptom score have significant improvement. The second, urine flow. The peak urine flow is still good and getting better after 5 years of the procedure.
Mm-hmm.
And the third benefit is quality of life. Overall quality of life of urination is much reduced significantly after the Rezum.
Mm-hmm.
And after 5-year follow-up. The fourth, almost 0% that affect sexual function, including ejaculation or erectile dysfunction.
Wow.
Okay, that is a take-home message.
So that's 5 and 4, the 5 indications for Rezum. One is those who are taking medications for a very long time and they do not want to take medications. I have a lot of these patients. Every time they see naturopathic doctors, they think they can avoid medication. But in reality, there is a time and space for it. Second, side effect of medication. If you're having too much side effect, such as postural hypotension, means low blood pressure upon changing your position, nasal drip. I've always been wondering, why post-nasal drip? How did the medication affect increased post-nasal drip, which means a lot of flow from your nose?
Not nasal drip, it's a nasal congestion. Mm-hmm. Okay, they're difficult to breathe. Because of the medication group is an alpha-1 blocker. Alpha-1 blocker relax the smooth muscle. Mm. It's aimed to relax the smooth muscle surrounding the bladder neck and prostate, but it's not specific. Mm. It's not specific muscle relaxant. It's relax the smooth muscle of the blood vessel. The blood vessel around the nose, in the nose, is swollen. So the patient feel nose congestion. Is around 10% side effect.
So we have smooth muscle all over our body as well. That's why it affects our nose as well as the blood vessels in our prostate too. Now, third, if symptoms are not better from medication, these are the people who are indicated for Rezum. Fourth, if you don't want surgery, you might want to explore this option because it's quite non-invasive and it takes only 10 minutes. And 5, the 5 indication, the 5th one being that if you're not fit for surgery for some reason, maybe was it anticoagulants during surgery that you need to administer and they're not fit for it, so this might be a reason why they might want to use Rezum, right? And after that 5 indications, we have 4 results that are quite beneficial and might be pleasurable to I wouldn't say pleasurable, but better than other treatments that are being offered out there today, which 5 years that has passed, we've seen that there's so little side effects from Rezum. Second is urine flow is pretty good, which is the main reason why they would come in the first place. Third is good quality of life, and good quality of life actually expands on the 4th benefit, which is close to 0% sexual dysfunction. Why is it close to 0%? Why not 0% sexual dysfunction?
Okay, because some patients have we inject into the ejaculatory duct and destroy too much prostate tissue. So it's occlude the prostate tube or prostate ejaculatory duct. Yeah.
Okay. So it can block the duct inside the prostate again. So that is a minor side effect. Which surgery would we have that with surgery too?
If TURP, the retrograde ejaculation can cause more than 70 to 80% after TURP, and almost more than 90% after HOLEP. So it's quite a significant number.
Wow. So this is the reason why we should look for Rezum, or actually ask about Rezum. Now let's take some questions from our listeners because there are a few questions. It seems like it's a big topic. So we have Pyrat Prisha. who asked, on average, at what age do they tend to get this disease? Actually, you told me this already.
Yeah.
50 or above.
After we, so I'm older than my mom, more than 50 years old. This problem start. So it usually starts after 50 years old, and more problem when we're getting older.
And that's the exact reason why you should go for a health checkup yearly, even if you have no problem. All right, let's take the second question. This is from Mashir Rahman. Sorry if I pronounce your name incorrectly. How long does it take to recover from water vapor therapy procedure?
Okay, very good question. It's very important. After the procedure, the patient have to interval or have a catheter during tube. When they go home, they can live a normal life with some urethral irritation from the catheter. Okay, normal life, but no exercise. Okay, and after the doctor remove the tube, the urine tube, some patient will feel transient frequency or urgency urination for 1 or 2 weeks, and the Rezum will have its own effect. It's around 1 month or 2 months after the procedure. The patient will feel getting better and better about their urination.
Okay, so that's at least 1 week from the side effects of Rezum, which is the inflammation. Then after that, where the catheter comes off, it takes around 1 month to 2 months, 3 months where you feel optimal.
Mostly around 1 month after the procedure, the patient feels significant improvement.
Wow, you heard the specialist. Around 1 month, and you'll feel the effects, which is good urine flow and not having to wake up in the middle of the night, right? And even if you do these procedures, do you still recommend your patients to exercise 3 months later, or how soon can they go back to exercising?
Okay, normally I advise the patient to have to do exercise around 3 to 4 weeks after the procedure.
Okay, 3 to 4 weeks. So if you're doing this procedure, we'll guide you through anyways. Next question that we have here from SM Shafiqul Islam. Again, so sorry to mispronounce your name, but here's another question. Is it beneficial only for benign enlargement of prostate, or you can do it for cancerous prostate? Actually, I know this question.
Yeah.
Only for benign.
Yeah, the FDA still approved for only benign. But I think in future, for the cancer, that blockage it can destroy any cell, prostate cell, not only benign and malignant. But now FDA approved only benign.
Okay. So for those of you who are wondering, yes, it does destroy cells, but in terms of cancer, we just don't want to disturb those cancer cells because it can spread if it doesn't completely die. So that's why the FDA hasn't approved yet until we need further information. So you have to stay tuned regarding this. Until then, it's only for the enlargement of the prostate in a benign condition only. Okay, so here's another question. Which is better, water vapor therapy or TURP or laser or BPH?
Yeah.
So there's 3 things they want us to differentiate. Which one's better in your opinion?
Okay, very good question. I discuss this topic at least 5 times a day. So when the patient needs procedure, I always discuss about every procedure, pros and cons, and its own complication. So we discuss about the pro and cons and complication of each procedure. Rezum, TURP, laser. Okay, and the patient, they choose which one that suitable for them. But sometimes the prostate size is huge, more than 100 grams, more than 120 grams. So we discussed that Rezum is less effective than surgery.
Okay, so you heard that there's no best treatment. It's hard to say which one's best, but it depends on what your condition is, and it depends on the situation that you're at. Sometimes Rezum might be better, sometimes surgery might be better, or sometimes laser procedure might be better. Am I right on that?
Yeah. Okay. Every procedure that you mentioned is available in Bumrungrad. For example, a TURP is conventional, so every hospital have it. TURP. Laser for prostate, we have a PVP laser and whole laser. So on every standard treatment of the prostate, so it's available here.
Wow, so if you're still wondering which one's better, it's best just to come to us and just ask, because we'll choose it for you. Well, we'll decide, we'll tell you which one's best for you, for your situation, for your condition. That way you don't have to pick and choose which one you want. And it's definitely safer if a specialist is doing this for you, screening the side effects and the benefits versus the benefits. I feel like I can be your good student. Would you consider that? Because the next question basically covers what you already told us about, which is, how many years does water vapor therapy last? Can I try answering this for you? Okay, so because it's been in the market for only 5 years, and within that 5 years, only 4 to 5% has this problem of having side effects or the problems comes back in terms of frequency, urgency, nocturia. Therefore, we still need more studies, but at 5-year mark, it seems like it's been pretty effective. To answer your question, how many years does it last? We still need more time.
Need more time. But we know the data only 5 years. Around 4 to 5% need surgery.
Mm-hmm.
Around 10% need to restart the prostate medication. On the other hand, 85% no need for medication or resurgery. 85% is significant, that doesn't need any prostate treatment.
Okay, 85%.
85% that
need extra treatment.
Can stop medication, no need to do any prostate surgery.
Okay, so you got your answer there. That's from Arif Khan. The next question, does water vapor therapy help in bladder neck obstruction and meatal obstruction?
Okay, very good question. It doesn't help. So it's very important that the surgeon have to check for the bladder neck obstruction and stricture. This should be treated with other procedure, not Rezum. Rezum or water treatment have to be treated only the prostate enlargement, not bladder neck contracture, not stricture urethra, not meatal stricture.
Okay. This person must be medical because they're using a lot of medical terms. Could we explain a little bit what meatal is and why is not effective for the bladder neck?
Okay, so the patient who have urethral stricture or meatal stenosis or bladder neck stenosis can have a urinary problem similar to the enlarged prostate, but different etiology. So the treatment is totally different. If you see the stricture is scarring of the urethra, the treatment is to dilate it or to incise it to have a bigger channel, not use this kind of energy. So it's not indicate to use the Rezum.
Okay, so keep in mind that the Rezum is for the transitional zone of the prostate. Therefore, any other locations might not serve the purpose. And that's the reason why we need to diagnose first. We never jump to treatment. We always have to diagnose correctly. That's why there's different procedures, including digital rectal exam followed by ultrasound or some other test that we have to do before we decide if this treatment is right for you.
That's why immediately before we do Rezum, we have to do endoscopy to check for the etiology, the cause of obstruction. If it's found that there are stricture urethra or the bladder neck connector, we change the procedure. We do other procedure, not do Rezum. So to check the cause of etiology is the most important.
So even if we decide to go with a certain treatment and along the way, our specialist can actually see this, that, oh, this person is not really right for this treatment, we can still change technique. So this is the reason why you should ask us first. And over here, we can do all of the things that were mentioned above, right? But Dr. Teerapon, though, not me. Don't come to me if you have this problem. Go to him. Okay, so the next question that we have is from Abdus Salam. The question is, patient has kidney function problems, but not severe. Is this a suitable treatment for this patient?
Oh, it's suitable.
Okay.
Because the procedure use only needle to inject into the prostate, so there is not contraindication for the kidney problem.
So short answer is yes.
Yes.
But again, come ask us again. We'll investigate and see if you're right for the treatment. So apparently there's a lot of questions here, but we couldn't get back to them. We'll probably try to answer them afterwards, if that's okay with you guys as listeners. Okay, don't get mad at me because we're running out of time and we have such really, really good information today. Not only you guys are learning, I'm also learning too. But to learn more about Rezum water vapor therapy, you may rewatch this video again, right? Or you can go see if you know someone or yourself is interested in this, you can always go through the BH application app on your phone, and you can connect with us and see if you can schedule an appointment. Or a second way is basically do telemedicine. And through telemedicine, we can tell you what are the procedures that are needed if you're fit for the treatment. So those are the 3 ways to get connected with us. And if you haven't liked our channel, make sure you do, because we have a lot of information today. And these information that, as you can hear, not only you guys find this interesting, I find this really interesting too. And I definitely will have to like this page as well if I haven't. I actually did. You guys didn't hear that. Sorry about that. Well, thank you so much today for all your information and your time today. I know that you have so limited time, but sharing this knowledge with us, honestly, it's been an honor and a pleasure to be moderating this for you. Is there any last minute words you want to give to our audiences today? I know you did cover the 5+4.
I will cover. So it's my pleasure to talk now, and you're welcome.
Mm-hmm.
If all of you have prostate problem, or your cousin have prostate problem, so it's a very, very common problem for the especially for the aging society.
Mm-hmm.
So this problem will be gonna increasing problem. So this is a kind of procedure that that is, I think is not, it's a minimally invasive procedure.
Mm-hmm.
This is quite promising result, especially in 5 years. It look pretty good.
Mm.
So this should be an intermediate treatment between medication and surgery.
Mm.
So this is a big group.
Okay, so we do have a lot of groups who fall in between surgery and medication, and this is a very good indication for Rezum. And through Dr. Teerapon's experience, he definitely have seen a lot, and he's seen that this new technology actually works better for some cases and compared to others. And this is the thing that we want you to explore. As you can see, our doctors are very friendly here. You can always talk to us. Schedule an appointment if you have any questions. But again, stay tuned for more information. Thank you so much for joining us today. All of you who joined us today, was it 60 people or a little bit more than that? I have more than 60 people. Thank you so much for joining us. I hope you learned something. We hope that you learned something. I definitely learned a lot from Dr. Teerapon today. Until next time, as for now, we're out of time. We hope to see you again and stay safe. I'm your host, Dr. Brian Kunakan. สวัสดีครับ